So the question is, what is the clinical value of circulating DNA currently in the setting of metastatic colorectal cancer or in colorectal cancer in general? First of all, the technology is there to determine circulating DNA in the majority of patients. Second, the question is, what do you want to measure? Is it a specific mutation, or is it the total of amount of circulating tumor DNA against the rest of the DNA? And depending on that strategy, there might be an implication for the patient. One of the open questions is, if you see something happen under pressure of a given therapy, chemotherapy plus targeted therapy, what is the clinical value? Do we need to continue the treatment? Do we need to change our treatment? So these are still open questions, and hopefully with follow-up trials, meaning having different samples at different time points, at that moment you can determine what is the real clinical value of circulating DNA. One of the problems with these trials in second line is that, first of all, they were conducted in different time points when other drugs were available. For example, if you look to the VLUR data, second line study with aflibercept, it's some years ago that it was conducted. And the strategy in colorectal cancer changed, the therapeutic options also changed. So it's very difficult to compare the results of all these different studies with each other. A second important point is that I already said that the strategy how to treat patients is becoming more flexible than before. Before it was treating first-line patients until progression and then going to a second line. Nowadays, in first line, we are much more flexible. We are treating patients sometimes with a period of maintenance, sometimes with a treatment interruption, treatment holiday. So the population going to the second line is also different. What is also playing a role is the fact that after the second line, you have different options also. Some years ago, there was nothing else after the second line. Now you have regorafenib, you have TAS-102, and some people believe in the reintroduction of drugs that we used in first line setting. So it's very difficult, based on the studies that we have today, to make an inter-study comparison.